This program is brought to you by Community Trust Bank, Medical City, Bid Select, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome everybody to Platforms, the life-lifting news program for women. This week we're talking about a very hot topic in healthcare, minimally invasive surgery. We're here broadcasting from the beautiful Medical City Children's Hospital that opened up in June of 2010, and we've got 5 of the top specialists from Medical City who will talk about how minimally invasive surgery, how they utilize that in their individual practices. Today, I'm absolutely delighted to introduce our first guest, Dr. Kathryn Waldrep. Dr. Waldrep is a board-certified obstetrician gynecologist, and she specializes in obstetrics, laparoscopic surgery, pelvic floor reconstruction, and urinary incontinence treatment. She's been recognized as one of the top doctors in Dallas, and she is now performing what's called SPA, which is single port approach laparoscopic surgery, which is the very latest technique available. Dr. Waldrep, welcome to the show.
Thank you.
I love our very serene background here
great.
at Medical City. It's beautiful, isn't it?
Beautiful.
Okay, you know, we hear this term quite a bit in the last couple of years, minimally invasive surgery. Why don't you explain to our audience what that is?
It used to be that when we needed to treat a woman or any kind of patient for disease process, we would just make a large incision and open the patient to take out whatever was diseased. And as time has progressed, we've found more and more ways to use minimally invasive surgery, and what that basically means is making smaller and smaller incisions to try and treat the disease process. So that is laparoscopic surgery, and in gynecologic surgery sometimes it is doing endometrial ablations or doing vaginal surgery in such a way that we're using very, very small incisions where people will recuperate much more quickly and be able to go back to work or to their daily functions much more quickly.
Right. And you as a surgeon, I mean, minimally invasive surgery is there's many pros for the patient, but sometimes you have to go with conventional surgery as a physician because it may not be the ideal situation to treat a particular patient.
Right. You really have to choose the patient, and you have to choose what's going on with the patient to decide whether they're the perfect candidate for minimally invasive surgery. If a patient has, say, very, very large fibroids, then you may not be able to use a laparoscopic approach. Or sometimes if they have a certain type of cancer, you may not be able to use a laparoscopic approach. But as the techniques have advanced, we are being able to do more and more surgeries laparoscopically or even robotically to be able to get patients up and back on their feet more rapidly.
Okay, let's talk about the various scenarios where you would use minimally invasive surgery. First of all, we've got some diagrams here because a lot of women, amazingly, a lot of us are not really aware of our anatomy. So why don't we first talk about treatment for fibroids,
okay.
Minimally
Well, laparoscopic surgery, let's talk about laparoscopic surgery and what we do in laparoscopic surgery. Laparoscopic surgery can be used for uterine fibroids, it can be used for heavy bleeding, it can be used for pelvic pain, it can be used for sterilization processes, it can be used to diagnose endometriosis. And basically when we do laparoscopic surgery, what we're doing is we're making a very small incision in the umbilicus or the belly button, and we're putting a telescopic type of instrument in. We are insufflating the abdomen with gas, and we're using carbon dioxide gas, which is totally benign type of gas, and it gets reabsorbed in the abdomen. Okay. And then we're using a couple of more small incisions where we can put in instruments which are pickups or scissors or whatever we need to be able to look around inside the abdomen or the pelvis. So this is a model I brought so that you could see. So we would make an incision going through the umbilicus, and then we could look in the pelvis, and this would be the uterus, these would be the fallopian tubes, the ovaries, here is the bladder, here would be the rectum, and we can totally visualize what's going on in the pelvis to see where the disease process might be, and we can actually lift up the uterus, we can look underneath the uterus, We can separate the organs. We can see if there's adhesions, and adhesions are scar tissue that might be have formed from previous surgeries, and really determine why one might be having pain. If a woman desires to have her tubes tied or clipped, we can actually pick up the fallopian tubes and tie those fallopian tubes off, or cut or burn the fallopian tubes. And then sometimes a woman might have a fibroid tumor, and we can see the fibroid tumor, and we can actually remove the fibroid tumor through the laparoscope, cut it off and morcellate it. Morcellate it means cut it up into really small pieces and remove it that way.
So you kind of vacuum it out through
We kind of vacuum it out. That's exactly right. And then we can actually do hysterectomies this way as well. And there are 3 different types of hysterectomies that are done laparoscopically. There are different terminologies for laparoscopic hysterectomies that are used. There is what's called an LATVH, and that stands for laparoscopic transvaginal hysterectomy. And a laparoscopic transvaginal hysterectomy is where we free up the uterus from either the tubes and the ovaries, and then we take the uterus out actually through the vagina. Okay?
Okay.
So we'd free all this up from the surrounding organs, from the bladder and from the rectum, and then we take the uterus out through the vagina, and this is the vagina here that you're looking at. So we do part of the surgery abdominally through the laparoscope, and then the rest is done vaginally. And then there's what's called a lash, and that's just an acronym.
LASH, okay.
LASH, and a lash is where we would free up the uterus laparoscopically, and then we take the uterus off from the cervix, and the cervix is actually left. So we just take the uterus, which you're seeing here, and remove it, and we actually cut it into small pieces, and then, as you said, vacuum it out abdominally. So there's no incision in the vagina with a lash.
Now, what about bleeding? Is there any residual bleeding within the abdominal area when you're doing all these procedures in there and grabbing these organs and chopping them up? How do you prevent bleeding?
We can use cautery, and cautery, we have instruments that will cauterize the small blood vessels that we encounter, and sometimes we use what's called bipolar cautery, which are little, which will clip little vessels that we see and keep them from bleeding.
That's wonderful. Well, doctor, we have to go to break here in just a moment, but when we come back, let's talk about I believe there's a third surgery too for this type of procedure, so fascinating information. Ladies and gentlemen, this is Siobhan Palmer with Platforms, a life-lifting news program for women. We'll continue our conversation with Dr. Kathryn Waldrep in just a moment.